How does ROS1 targeted therapy treat lung cancer? Imagine a tiny switch inside your cells that, when turned on in the wrong way, can cause cancer to grow. In some lung cancers, especially a type called non-small cell lung cancer, this switch gets stuck in the on position because of a genetic change called a ROS1 gene fusion. This abnormal activity makes the cancer cells grow and spread faster. ROS1 targeted therapy works by specifically blocking this faulty switch. These drugs are designed to attach to the enzyme called tyrosine kinase that the ROS1 fusion protein produces. By binding to this enzyme, the drugs stop it from sending signals that tell the cancer cells to grow and divide. This interruption can slow down or even shrink the tumor. The first drug approved for this purpose was crizotinib. It was originally used for other targets but was found to be effective against ROS1 positive lung cancer as well. Since then, newer drugs like entrectinib, ceritinib, lorlatinib, taletrectinib, and repotrectinib have been developed. These newer drugs are especially helpful when the cancer becomes resistant to earlier treatments or spreads to the brain. Taletrectinib, for example, is an oral medication that has shown promising results, even in patients who have already tried other ROS1 inhibitors. It can help control tumors that have spread to the brain and overcome some resistance mutations. Like all medicines, ROS1 inhibitors can cause side effects such as vision changes, diarrhea, fatigue, liver issues, lung inflammation, or irregular heartbeats. Despite these advances, some cancers eventually develop resistance to these drugs, which means they stop working. Researchers are actively studying how resistance happens and are working on new drugs to keep fighting the disease. Combining ROS1 targeted therapy with other treatments like chemotherapy or immunotherapy is also being explored to improve results. In summary, ROS1 targeted therapy treats lung cancer by blocking the abnormal activity of the ROS1 fusion protein. This precise approach targets the root cause of the cancer's growth, offering a more tailored and often better tolerated option than traditional chemotherapy. Always remember, if you or someone you know is dealing with lung cancer, it is essential to consult healthcare professionals to determine the best treatment plan based on individual circumstances. Ongoing research continues to improve these therapies, giving hope for better outcomes and quality of life for patients with ROS1 positive lung cancer.